Welcome to today's webinar, MyCare360 Next Generation Disease Management. I'm Jenna Westenberg with HealthCheck360. We have a great presentation for you today, but before we get started, I'd like to take care of a few housekeeping items. We will have time for questions at the end of the presentation. If you have any questions, please type them into the questions section at the bottom of your screen. We will be posting a recording of the webinar online, so if you'd like to replay this presentation at a later date, it will be available. Whether you know it as disease management, condition management, or chronic care, today we have a few members of the HealthCheck360 team with us to talk about some exciting new technology in this space. First, we'll talk a little bit about the agenda. Trent will start us off with why we should think about disease management. Jessica will chime in with healthcare trends. Eric will provide a demo of MyCare360. Trent will talk about some results that we've seen with clients in the space, and then we'll wrap up with some questions and talk of population health impact. Now I'll pass it over to Trent.
Thank you, Jenna, and thank you again for everybody who took time out of their busy day to join us. As Jenna mentioned, the focus today is disease management, and I'm going to repeat one of the things that Jenna said, but this program can go by multiple names, and we just want to avoid any confusion with that, as it can be referred to as condition management or chronic disease management. We use these names interchangeably, so just know that that is the program that we're talking about. Regardless of what you call it, we are very excited to share with you a new tool that we have made available to our members enrolled in our disease management program. And we have a very special offer that we're going to get to and announce at the end of the webinar, so make sure you stay online and all the way to the end. But before we get to the demo of the new tool, I wanted to be sure we took a minute to discuss what disease management is and why it's important. So what is disease management? To put it simply, it's a program designed to support people diagnosed with a chronic condition. That could be diabetes, high blood pressure, or heart disease as a couple examples, and supporting these people to manage their condition, which means helping members to assure that they're taking their medications as prescribed, that they're completing regular blood work, seeing their doctor on a regular basis. Doing these steps helps to prevent the condition from progressing and reduces side effects from the condition. It also helps prevent ER visits, inpatient stays, and other catastrophic claims. So use hypertension as an example. If somebody has uncontrolled hypertension, they might present to the emergency room with shortness of breath or pain in their shoulder, pain in their chest. That could result in an inpatient stay, that could progress into a surgery, angioplasty, or even open heart surgery. So those are the types of things that we want to try to avoid by helping people to manage their condition. So the goal is to help members to help themselves avoid these side effects of their conditions and to live a happy and healthy life. Doing so also helps you control your bottom line. So I've outlined some statistics above on the slide here that talk about diabetes and hypertension, and it shows the prevalence of these conditions and the medical costs associated with those conditions. So the American Diabetes Association reports that there was $237 billion spent in direct medical costs related to diabetes in 2017. The chart shows that where these dollars are being spent. And you'll notice on the far right, hospital inpatient was 30% of the cost, and prescribed medications was 30%. So that's 60% of the total cost. Hospital inpatient stays is certainly something that we can help to reduce, if not eliminate, by helping people to control their medications or their disease. Prescribed medications, some of that could be considered good dollars, because we do want people to take their medications as prescribed. But if you're not controlling your condition in other ways, you might be put on more medications, or those medications might progress and become more costly, using insulin as an example. You'll see that adults with diabetes incur an average medical spend that is 2.3 times that of someone without the condition. And adults with high blood pressure incur an additional almost $2,000 more medical spend each year as a result of having that condition. The last statistic on the slide is looking at the number of people who are diagnosed with these conditions. So currently, the American Diabetes Association is saying that about 9% of adults have diabetes. And the scary number there is that 26% have pre-diabetes. And if you look at hypertension, right now it's about 46% of US adults have hypertension. So as mentioned on the previous slide, there are very real side effects for those living with a chronic condition. You can see how those dollars are being spent. So you have employees who have reduced employment, so 42%, who are maybe not able to work full-time, not able to work 8-hour days or 40 hours a week, and so they have reduced employment. You also have presenteeism, and those are people who are coming to work for those 8-hour shifts, but maybe because of symptoms and side effects that they're experiencing from the condition, they might be more fatigued or maybe not performing at the best that they could be if they didn't have those conditions. So hopefully this helps to paint a picture for the value of the disease management program. I'm going to turn it over to Jess to talk a little bit about the trends that we are seeing in the market space.
Awesome, thanks Trent. So really, with our team out and about and talking with different brokerage firms across the country, clients of all sizes across the country, we're seeing some trends in the healthcare space specific to condition management. And specifically over the last 18 months or so, we've seen a large emphasis on what I'm going to call point solutions. So this is going to be solutions that are focusing specifically on diabetes management, chronic care, or like kidney disease and those types of things. And so we've seen a large number of companies that are companies where their sole focus and expertise is focusing on these types of solutions. So according to recent studies, about 80% of employers are looking at these types of point strategies. And as you can imagine, the industry is looking towards technology to improve the user experience and provide support to members at their fingertips. Another thing we're noticing is that where all the HR people on the phone are probably thinking, okay, if I'm serving these types of solutions out of my carriers, it's now creating more work for me as an HR member to provide my diabetes management program, my EAP, my financial resources, and so on. So what we're also noticing in the space is that finding a partner that can really support multiple program components is a trend that's kind of exploding as well. So knowing that HR teams are spread thin, if we can limit the number of implementations and provide a solution like HealthCheck360 that is both your wellness provider and your disease management provider, you're not losing program impact, and it's kind of a win for everyone when you've got one implementation. So those are some of the trends that we're seeing in this space right now.
Okay, so we're getting close to the demo. We've got 2 more slides. We just want to talk really quickly about the HealthCheck360 disease management program and really paint a picture of the entirety of the program, and then we'll get into the demo. And I think it'll be easier to understand how the mobile app and the demo complements the current program that we have in place. So as you see in the first bullet point, we use data to drive the program. The first thing that we do is work with your carrier to set up a regular claims feed to get medical, prescription, and vision claims. And if available, we also work with your wellness provider, whether that's HealthCheck360 or a different wellness provider, to collect biometric data. So using that data, we complete a monthly enrollment process, looking for any members who are taking medications for a specific condition or going to the doctor and their visits have a diagnostic code related to a specific condition. And we're looking for new people who have recently been diagnosed with a condition. We also use the biometric data. An example of why we would do this would be, let's say that somebody completes a biometric screening and they have a A1C that is above 6.5. In the medical world, that would be considered a diagnosis for diabetes. But if this participant hasn't gone to the doctor yet, we're not seeing any claims, they're not taking any medications related to the condition because they don't know that they have it yet. So we're going to add that person, we're going to enroll them in, so we're helping to catch people early as soon as we can, and making sure that they are receiving treatment and getting to see their doctor for that condition. So again, we repeat that process on a monthly basis. After we identify somebody for enrollment, we're going to send them a letter and follow it up with a phone call from our clinical team. And on that letter and the phone call, we're going to help the participant to understand, here's what the disease management program is, here are all the steps that you need to complete, what's required of you during the program year, and if there's any incentive or accountability pieces that are associated with participating in the program and completing all of those tasks. where they're going to follow up with that participant at least on a quarterly basis to make sure that they are aware of where they stand in the program, answer any questions that they have, and making sure that we have all of their medical conditions and information up to date in our system. A unique piece about our program I mentioned regarding enrollment is that enrollment is automatic. So we don't let people don't opt into the program. We automatically enroll you in the program if we see that you are diagnosed with one of the defined conditions. So then we continue, as I mentioned, to support that participant throughout the rest of the year, which leads us into the mobile app. And so being diagnosed with a chronic condition, nobody wants to be diagnosed with diabetes. It can be challenging. You're going through potentially just some feelings associated with, I'm just diagnosed with this condition and not really knowing how to manage it. What we want to do at that point is to dive in and support that person to make it as easy as possible for them to manage it. So they do have clinical staff that they're going to be working with and continue to work with the same person throughout the course of the program. But we also, as Eric's going to show here in a second, released a mobile app that we call MyCare360 that the participant has access, 24/7 access to know where they stand in the program, what any incentive or accountability pieces are associated with completing the program. We're also going to have, the participant will have reminders to complete their to-do list. So in our world, we tend to say cares that they need to complete, but for the members, we're saying you have a to-do list, you have action items to complete. And we're going to remind them when those things need to be completed or if something becomes overdue. So with that, Eric, I think it's best left to you now to showcase what it is that we're talking about.
Yeah, absolutely. Let me just switch over really quick. All right, here we go. Okay, so again, my name is Eric Peters, Director of Product here at HealthCheck360, and I'm going to give you a quick walkthrough of the actual app. So right here you'll see, very similar to the previous graphic, this is the first page you'll see when you come into the app. It'll give you at the top there a graphic of your progress within your program, that yearly program that you're in. So you can see here that I'm 38% through my program. What that correlates to is the to-do list below. So if we kind of scroll through this list, you'll see I have 5 items in my to-do and I have 3 that are completed. So I'll know that I have 3 out of 8 completed, so 38% there. I can also go in here and if I wanted to access any of my program information, I'd have an easy click to be able to get that and scroll through all the information regarding the program and anything that relates to that. I'm also able to directly from the app schedule a call or at least request communication with the HealthCheck360 team. And so I'd be able to go in and request a call. I can put in my phone number. I can select the best time to call and the details of why we want that reach out back. So going through the list now of all my cares. So these are all the things that we need to do for my condition throughout the program. So you'll notice I have a couple different things on this list. I have a second A1C, second office visit, lipid, and you'll notice some details on those cards. They give you complete by dates. The complete by dates on those are related to the last time that we've known that you've gone and done this item. And that's based on the claims feed that's coming in. And so you can notice for the piece down at the bottom, the microalbumin, we want you to get that yearly. And right now it's past due. Our suggestion was for February 5th. That's because a year ago, on February 5th of 2019, was the last med claim we got for that piece. Is there anything you want to add on that, Trent, or is that?
I think that's exactly, well, yes. So some of them are annual, and as you'll see, the second A1C and second office visits, and those are specific to people diagnosed with diabetes, where we want to have those done on every 6 months. Mm-hmm. But in most cases, all of the other cares would be annual.
Right, right. And so this is just a really easy way for participants to really see where they're at and kind of transition from maybe a quarterly physical letter that goes to their house where they can now look at this, you know, any day that they need, they can get in here. If they want to update it themselves, say I went and got my second A1C and I'm kind of anxious to update it myself, I can do that. So I can go into the second A1C, I can put in my visit date. I can add a document, whether it's going to be a photo or something that I have already taken, and I can send that in. But if I don't do it, again, we'll get that claims feed in and we'll get that transitioned over to a completed item when that comes in.
I think that's an important piece to clarify, is that the members don't have to submit every time that they complete something. We will know automatically from the claims feed, and we'll also know if we're collecting the biometric data. So we will update those automatically, but if a member does want to submit ahead of time before we get that claims feed, they're welcome to do that.
Yeah, that's right. And I think that's one of the neat things about this is you can come in and you don't really have to do that much work. We kind of do it for you here, and so you can come in and see your status all the time.
Mm-hmm.
One of the other things you mentioned, Trent, was transitioning to a day-to-day care piece. And one of the things we do to allow that is going to this space where you can track your biometrics, your activity, your wellness day to day. And so you can either do that manually or you can connect a device. And for those that are familiar with the HealthCheck360 wellness platform, we allow dozens and dozens of apps and hundreds of devices to be connected to our system. And with MyCare360, we also have that same ability. So we'd simply be able to go in here and connect a device, connect an app. So you can see that I have Apple Health and Garmin Connect attached or connected to my device here. So with those things connected, I can go over to this tracking tab on the bottom, and I can see all of these health and wellness pieces that relate to me and the things I do every day. So as an example, I can go into my glucose and I can show you all the stuff that I have logged for this. Why is this important? This is important because not only do we have a yearly program where you maybe have 8 things you need to do as care items, but we're also going to help you do this day to day. You can track your glucose scores, you can track anything with your heart, blood pressure, your steps, activity, whatever it is that relates to your condition, you can also track that here. So it's all combining that into one space. And that is pretty much everything I have, unless Trent, you wanted to add anything else while I have it up here?
Yeah, just the key thing is just trying to make it as simple as possible for the user. So again, they log in, they see the 38% of the way through the program, so they can go and see their to-do list and what is left over for the year. So on the very first day of the program year, let's say that the program year starts on January 1st, then all of the action items that need to be complete would be on your to-do list. And Eric, if you scroll down, once something is complete, then you see what those care items are that were since completed. The other piece that's important is medication compliance. And so you can see this person has medication refills that are up to date. If it wasn't true, then it would be a red bar across the top, drawing attention to the fact that, hey, it looks like you haven't been filling your medications as prescribed. And so they would have that very direct alert or reminder to do so. Or if there was a change in medication, then they can request a call or call their nurse and help them to understand, hey, this script was canceled, I started a new script, or what have you. But just to make sure that the participant and our clinical team are in conversation with that participant, and so that they can best manage their condition.
Awesome. And on top of that, I just had one more thing I wanted to show. With the demographic of the people with conditions that will be using this, a lot of them may have glucometers, blood pressure monitors that don't have Bluetooth or don't connect to any digital piece like we have here. We understand that, and we don't expect anybody to go out and buy those types of expensive devices. So we also offer the opportunity to easily transition and scan in your information. So for instance, if I was going to go to glucose here, and you'd see when I hit that plus in the top right, it brings me to this page, and you'll see scan your devices, which allows me to take a non-connected device from our list of glucose devices here. And the one I have in my hand right now is the Freedom Style Freedom Light. So if I put this right here and we scan it, get this here, and so you can see right there is exactly what we have. And what it'll do is it'll read the screen, scan it in, fill it out, and you can automatically just say, add that in, and we'll have logged that measurement for today. So it's just another way to make it easy for people to use this, even with their kind of prior purchased devices that may not exactly connect.
Yeah, I would say outside of the fact that participants now have 24/7 access to be able to view what to-dos they need to complete and when they need to be complete by, that's the part I'm most excited about, is the tracking component, so that our team of clinicians can have a more meaningful conversation around their blood sugar, their blood pressure, looking at their nutrition and exercise, and helping that participant, of course, making sure that they're taking medications and seeing their doctor, but also starting to make lifestyle changes to improve the health, their overall health.
Okay, great.
All right.
Thanks, Eric. Now we're just going to move back over and look at some results of trends.
Yeah, so we talked about why condition management or disease management programs are important. The cost, the medical cost, the productivity that is lost, the impact it has on a participant on a day-to-day basis. So why this program is important. We overviewed the HealthCheck360 program and demoed this tool to try to make it as easy as possible for participants to be compliant. We want people to go on living their life and to not obsess over when do I have my next visit. We want to make it as easy as possible for them to know when that is due and to make sure that it is being completed, because it is so vitally important for them in terms of their own health and providing for their family and living a long, happy, healthy life and being good employees. So what does that mean in terms of outcomes? So we've got a case study here that we're going to look at, and this is a transportation client that, as you can see, has been with HealthCheck360 since 2015. This is a 2,500 employee life group that we're looking at. And you can see in 2015 was baseline year. So they implemented the condition management program in 2015. Prior to the program being started, you can see what their compliance rates were. On the far left is diabetes. So you can see that there was 4% in 2015. That's actually kind of on the high end for what we normally see for baseline for groups. Typically it's 2% or even lower for compliance for diabetes, but this particular client was at 4%. And then what we did, they had an outcomes-based, I'm sorry, not outcomes-based, they had an accountability-based program that they implemented. And you can see in the very first year, by the end of that first year, people with diabetes went from 4% compliant to 75% compliant. And then through 2019, we kept them at 70% compliant or higher. That's really impressive. And then if you look at high blood pressure, which is that second darkest blue bar there, they started out at 45%. And then you can see we got them to just shy of 90% and then kept them right at 90% for the remaining years, and so on and so forth with asthma and COPD. So the compliance rates are very impressive, and you can see that in terms of getting people to take their medications and see their doctors, getting their lab work done, the program is effective and people are completing those tasks. So then what does that mean in terms of health outcomes? So this particular client, they also started to do biometric screenings with HealthCheck360. And I don't want to assume everybody knows this, but so just to really quickly, HealthCheck360 also does biometric screenings. We do a blood draw with participants, and then we give them a score of 0 to 100, 100 being the best score that somebody can get. And our score is based solely off of objective data from that biometric screening. So their fasting blood sugar, their blood pressure, their cholesterol ratio, glucose levels. We take that information together and we give people a score. So again, the higher the score, the better. And you can see, let's look at 2016 on the far left. Those who were not compliant with their condition, not taking their medications, not seeing their doctor, not getting all their lab work done as they should be, their average score in the first year was a 38. And then those who were compliant, who were taking those steps, their average score was a 66.6. So quite a difference in health improvement, which makes sense because their blood pressure is more under control, their glucose is at a healthier range, their cholesterol levels are at a healthier range. And then the third graph or bar there is The gray one, those are people who do not have a condition. And as you'd expect, they have the best score of everybody, 73.2. So getting people to be compliant does impact their health. So then what does that mean for claims? And so we're looking at two charts here, one for diabetes and one for high blood pressure. The one on the left looking at average cost for diabetes. So the American Diabetes Association says that the average cost for somebody who is diagnosed with diabetes has an average annual medical claims of $16,700 a year. For this group, we saw that the average participant that was diagnosed with diabetes, their average cost was just below $8,000. So almost half that of somebody of what we'd expect to see on an average national level. And same thing with high blood pressure. People in the Health Check 360 program, it's about $2,000 less per year in medical claims versus what the American Heart Association was saying for their average cost per year. So making a program to help people to help themselves, to manage their conditions and to manage their health does help to improve their compliance. And as we saw there, the impact that has on their overall health and also the impact it has on medical claims. Jess, I'll turn it over to you.
All right, perfect. So some of the things that are specific to Health Check 360 and what's driving the results that Trent has shown you on a number of slides today. So we do really get some impactful results with our clients, and it's a step-by-step approach. Not all clients that are in our condition management program go full speed ahead. So really thinking about how we can scale the program and grow the program over a period of time. A lot of our clients will start with a participatory year, meaning that it's completely voluntary. There's no incentive tied to it. It's really an introduction of who is Health Check 360, why are they calling, what resources are available, so that they can get to know us. And that was similar to the case study that Trent had mentioned. I would say a majority of our clients start year one as a voluntary year. And then they grow the program in multiple years and start to add incentives in place, which really skyrockets those results, as you saw with those case studies. Other groups will start with just employees and roll that out for employees, and then introduce the spouse and dependents in years 2 or 3 of the program as well. So you can get really creative with an incentive strategy, and that's what your Health Check 360 consultants can support you with. But we are seeing the trend being that companies are looking to implement some sort of incentive tied to compliance rates. So whether that be tied to the premium differentials that they're doing, similar to a wellness program, whether it's earning HSA dollars, or what's also really popular right now is giving members free prescriptions, medications, reducing copays, those types of things if they're compliant with their condition. So reducing those barriers and making it more affordable. I would say another thing that's specific to Health Check 360 is the data sets that we're looking at and the integration between different data sets. So what I mean by that is with the carrier programs, they tend to just look at claims data to identify individuals that have a chronic condition. But as a lot of us know, you're missing a percentage of the population when you just look at medical claims. You're missing the people that either A, don't know that they have a condition, they're going undiagnosed, and therefore the first time they find out may be a catastrophic claim or a catastrophic incident. You're also missing people that haven't been to the doctor and aren't managing their condition, and therefore they know that they have diabetes, for example, but they're not managing it. And again, your likelihood of having a catastrophic claim with those individuals is higher as well. And so we marry the biometric data, the medical, RX, and vision claims to be able to really get a whole view of the different individuals and members on your plan that have a condition. And then, of course, the technology, which was a large focus on today's presentation, having that at the member fingertips is really important. Making sure that we are helping create sustainable habits, long-term behavior change, and the way of the future is technology. And so having those mobile capabilities is really important on the member level to improve the user experience and ensure that we are supporting them on a day-to-day basis. So you may be thinking to yourself, well, am I a good fit, or do I have clients that are a good fit for the condition management program with HealthCheck360? One thing to note is this is a program that a lot of our clients tie on to the wellness services, but some of them are just condition management clients with HealthCheck360. So if you absolutely love your other wellness provider that you're working with, by all means, we're happy to play nice in the sandbox and share data as needed. But we do have a lot of our clients that are using HealthCheck360 for their wellness services, and they're looking to grow that and add on the condition management program to it. The other thing that I would say is from a perspective of being able to receive data, when I think about ideal clients for this program, I think of self-funded groups or large fully insured groups where we are able to get the claims data from the carrier or TPA. I think that piece is important in the success if you are going to carve out your condition management program from your carrier. We need to be able to get that claims data, so that is a big component. So those are the things that I would say to think about. Trent had alluded earlier to staying on the line and making sure you hear our big announcement. So for those that are participating in today's webinar, we are waiving our implementation fees for 2020. So if you decide that this is a program for you, you want to move forward, we're really excited to get you on as a new client for our condition management program. And as an advantage to that, we are going to waive any implementation fees that go along with that. So really excited for that.
Okay, great. Thanks, Jessica. And just a reminder, everyone, we are going to answer some of your questions. We already have a number of those pouring in, but if you do have a question, please feel free to type that into that question section at the bottom of your screen. Okay, so we'll get it kicked off with the first question. How does this work with your primary care providers?
Yeah, so good questions. We definitely want all members that are enrolled in the condition management program or disease management program. I apologize. I know we use different terms throughout the presentation. They are one and the same. So we do want all members to continue to work with their primary care physician. This is not meant to replace any medical treatment somebody is receiving. So for example, anybody enrolled in our condition management program, they should be seeing their primary care physician at least annually, and that is one of the items on the to-do list. We will know when that is completed because once that member goes and sees their physician, it'll create a claim, and once that claim file comes over to us, we'll mark the primary care physician or provider to-do action as complete. So we definitely complement the current provider services that they're having, and we're trying to continue to encourage that relationship.
Okay, great. And just a reminder for everyone, who does have access to the app?
Access to the app is, another great question. The MyCare360 app is designed specifically for members who are enrolled in the condition management program. So anybody enrolled in the condition management program would have access to the MyCare360 app.
Yeah, and if they are part of the wellness program and identified as having a chronic condition, there's a link in the MyHealthCheck360 app that goes and takes that individual directly into MyCare360. So all of those links are there to, again, make it very easy for members that do have a chronic condition to access all resources that are available under the HealthCheck umbrella.
Yep. One username, one password.
Yep, exactly.
Yep, and then all the information regarding your tracking, if you track it in our MyHealthCheck360 program, it will also automatically show up in your MyCare360 program and vice versa. So you only have to enter your information once if you want to do that.
Now with that access question, we did have some questions around child dependence. Is this app available for use with child dependence?
You know, it depends on it's a discussion with the employer on who we want to enroll in the program, and we do see that commonly when asthma is elected. So that would be the one case where we would have child dependents that are included in the program. But really, it comes down to a discussion on to what disease states do we want to elect. So you can elect 2 or all of our disease states, and then we would have that discussion on employees and spouses and dependents. So that would be a consulting question that we would help you to address once the program is designed.
Yeah, exactly. Asthma is the most common one that we see. Child dependents have their own kind of care items that they need to complete, but the majority of the other ones, we don't see the children being diagnosed as much with them, and so majority of those other conditions, it is just employees and spouses on the plan.
Perfect. So do we provide providers with lists of employees that have been enrolled in the program?
So from a provider perspective, I think of that as like your primary care doctor or the practicing physician that's working with the individual. So that is going to be on a case-by-case basis depending on the individual and member that we're working with specifically. So as we're having conversations with the member about their congestive heart failure, for example, that is in a lot of instances going to include conversations with their provider. And so in those instances, we get permission from the member and then have the conversation and drive that with their provider. As far as, and I see another one of the questions is around PHI and making sure that their data is private. So I think those go hand in hand. We don't just shell out data unnecessarily to different companies. Our goal is to really make sure that the right data is getting in the right individual's hands. And so in some cases, that may mean that we want to send a list of biometric information or individuals that have a chronic condition over to a data management company. So for example, Springbok and Deerwalk are two of kind of the industry leading data management companies, and they do a lot of work around claims analysis and those other items. So in those instances, if a client has access to those types of data systems, then we will share data, but we will not be providing a list of everyone that has a chronic condition to the employer. We provide incentive reports. So they'll know Jessica received the incentive specific to the condition management program or specific to the wellness program, but they aren't going to know that Jessica has diabetes, my A1C is a 12, and I haven't filled my medications over the last year. So we're very particular, and as part of our communication strategy, we address all of that with the members to make sure they know exactly who's receiving their data, why they're receiving it, and the privacy rules that we do have to follow. Probably a long-winded question, but I feel like I answered both. So
one other thing to think about with the mobile app is when the member is speaking to their physician, they can pull up the mobile app and the list of items to complete and have that discussion right there. It makes it really easy and convenient for the member to have that discussion with their provider to say, hey, it looks like I need to have my next So that's a good one. There was also another question about how do we direct participants to MyCare360, another great question. So all the communications that we're sending out, I mentioned welcome letter, and then we're doing quarterly outreaches. Anytime we're communicating with somebody, whether it's print, email, or phone, we're always going to be talking about the MyCare360 app and directing people to that because it is such a useful tool and assuring that participants understand where they are in the program and what is being asked of them. And then also provides them a direct link back to their nurse, the clinician team to answer any questions that they might have.
Okay, great. Thanks, Trent. And it looks like that's all the questions that we have from the group today. Do you guys have any parting thoughts?
yeah, I know one question that we always get, so I'm shocked it hasn't been asked yet, but I will address it. So I know pricing is always the first question asked. So that's something if you are interested in learning more or getting a custom quote specific to your company, please reach out to us and let us know, and we're more than happy to follow up with a quote for you.
Okay, great. Thank you so much, you all. All attendees will receive a follow-up email with links to the presentation recording and contact information for all of our presenters today. This concludes today's webinar. I hope you all enjoyed the presentation. In the meantime, be sure to subscribe to our blog and follow us on social media for the latest on HealthCheck360. Have a great day.